Good morning. I am so excited for you to be joining me today, and thank you. I always want to make sure you get a ton of value from me, and I want to always help you navigate through health information overwhelm, feel more confident in your health decisions, and this should be a really short 30-minute workshop. And we'll have time for Q&A at the end. You can email me, and that's also a way to get in touch with me. It's hello@labellisemd.com, or you can hit me up on Instagram at labellisemd as well. So, for those of you that don't know me, I'm from Puerto Rico, living in sunny San Diego, and I'm married. I have two young girls, and I started this business because I was just tired of seeing my friends and family get taken advantage of by diets and fads and false marketing and other gimmicks. And plus, my husband is a former NFL player, and when he was diagnosed with some mild neurocognitive deficits, it freaked me out. And it really kicked us into gear to living our healthiest lives. And now my purpose is really in teaching my patients, and then now all of you everything that we know. And I'm just really thankful that we have that opportunity to do that. So thank you for being here. I love your commitment to your health. I want this to be engaging and interactive. And let's get going. So the cost of healthcare, your valuable time, and just all the things is incredibly important. And you want to leave your doctor's office with no regrets or thinking, man, I forgot to ask this and I forgot to mention this. And here's the thing, no matter all the stuff I'm going to say, if you did forget to do something or say something or whatever, move on, schedule a follow up appointment. And your doctor will really appreciate a scheduled appointment so they can actually be reimbursed for their time and be more willing to take the time to answer your questions in a thoughtful way where you feel heard and validated, but their time is also being accounted for. I mean, we've all had the experience with lawyers that literally bill you for every second you spend on the phone with them, every email, etc. I mean, when you call them, it's like you want to vomit everything out on an instant so your bill isn't so high. Anyone else been there? I know I have. So, in medicine, I know medicine is considered a position of public service and, frankly, isn't a good look if we're nickeling and diming our patients. I get it. But the reality is medicine is a business and our healthcare system is changing in ways that aren't good, and we're losing control of our time. And we're being told by hospital administrators and insurance companies how to perform, how much time to spend with our patients. And oftentimes it's not up to us, and it's at the expense of a patient. So, a way to game the system, so to speak, is schedule a follow up appointment with your doctor. And that way you can get unanswered questions answered, and that's totally okay. And with virtual appointments now available these days, and it's the norm, there's really no excuse and certainly no regrets. Okay. So, there we go. So, just taking a step back to actually preparing for your doctor's visit, you want to hone in on what's your question that you want to be addressed and that concern. And each visit that you have should be an individual concern, not a laundry list of issues that you waited years to get addressed in a short visit. I know some of you are like that, and it's okay. I get it. But you have to approach each visit with the expectation that one or two unrelated items are going to be addressed at each visit so that you aren't feeling disappointed or unheard or taken care of. I mean, it's your health, and really it should be very focused. Some people have, 10 medical problems and others have one or maybe none. But the point is really focus in and hone in for each visit being very specific. And, it really helps your doctor stay focused. Anything more than that, and that's really what follow up visits are for. So, if you want to have some questions ahead of time that you want to ask, write them down so you don't forget, or put them on your cell phone in your notes section. It's really easy to get distracted or derailed during the conversation with your physician, and you'll forget. And you don't want to find yourself feeling like you just got derailed and you're confused the second you walk out the door. So, on the same token, write down notes or key points that your doctor mentions during the visit. So you remember what they said, like what's your to do list, when to follow up, like what medications to take, what medications to stop, all the things. Or better yet, bring a family member or friend to your visit. It's always a great idea. They can be your ears and especially your memory, especially when there's a serious medical condition. in which you want someone to help advocate for you and support you during the process. It's unbelievable sometimes the difference between what is actually said in a doctor's visit versus what is heard. And two sets of ears are way better than one. Okay. So this one's really important. You have to get, or try to, I get it's tough, but try to get your old medical records faxed in or sent to your doctor for review prior to your appointment, or have them in hand for the visit. Showing up empty handed if you have a complicated medical history does no one any good. And it's honestly unfair. Our healthcare system is really disjointed. Our systems don't communicate. And it's really helpful for you to be your own record keeper. Like you've got to take ownership of your health in this part. And lastly, you've got to know what your family history is. And even when you think it's not important, and I have a great example of this, and I get this all the time, is some patients will not tell me some of their family history, like breast cancer, because when they're seeing me, they think that all I care about is colon cancer, when actually it all matters. There are some colon cancers that are related to breast cancer, or even stomach cancers that are related to breast cancer that could completely change my recommendations if I knew more history. So the lesson here is don't assume a history is not important. It's all important. All right. Who's in the white coat? Anybody know? So in this case, the guy on the left is from the show Schitt's Creek, and which was really hilarious, by the way. But he's a veterinarian. Okay. And this just goes to show that lots of people call themselves doctors, but in the hospital or clinic setting, a doctor equals physicians for us, right? A physician for humans, certainly not for animals. And a doctor in clinical settings is sometimes used very loosely. So I want you to be aware. When you schedule an appointment, always ask who you're going to be seeing. Typically, it's going to be, one of three options. It could be a physician assistant or PA. And so you'll hear these abbreviations and realize that that's what that stands for, physician assistant or nurse practitioner, NP, or it could be a physician or medical doctor. And one caveat is if you're at a teaching hospital, there could be medical students or physicians in training that you may see initially, but all those particular cases, they're going to be supervised by a physician. So, no, and depending on where you live, physician assistants and some nurse practitioners could be practicing medicine completely independently, meaning without supervision or the guise of or they have the guise of supervision, I should say. And so it's something just to be mindful of. PAs and nurse practitioners are excellent members to a care team. You just need to be aware of what you're working with. Again, this is all so you can be a better advocate for your health. I mean, I've been to appointments myself as a patient where someone's walking into the exam room and they don't introduce themselves, and I don't even know who they are. And honestly, sometimes I don't even ask to confirm who they are. And that's embarrassing because I should have. I should have asked. So if it's happened to me, I'm sure it's happened to you. Never be afraid to ask. I'm sorry, I didn't catch your name. And usually that's kind of a no offensive way to just ask the person their name in case they didn't, or you can't read their name tag. But either way, I mean, the professional thing to do is like, hi, I am nurse practitioner blah, or I am Dr. Blah, and I'll be taking care of you today. But people that don't have that need to be identified, or they don't have that sort of bedside manner, need to be kind of brought back to present space and need to address themselves and introduce themselves. So another really good thing is if someone you request to see a physician and then someone else shows up, right? So you thought someone else was going to walk into the room, you have every right to cancel that appointment or request to see someone else. Don't think that you're being difficult. You aren't. You're just advocating for yourself, and that's it. And you don't have to apologize or explain yourself. Finding the medical professional for your care is kind of like finding your life partner. It takes time, and you might have to check a few people out. And this is especially important if you have a chronic medical condition, because then you're in this relationship for the long haul. And at least make it enjoyable. You want someone that's going to communicate well and relate to you in some way, can empathize with you, advocate for you. You definitely don't need the smartest person on the block or the big time researcher that discovers the cure to cancer. I got to tell you, probably one of the most important traits of a good healthcare provider is someone that can say that they don't know when they don't know. but is willing to look things up for you or connect you with a specialist when you need it. That's what you want. You want someone that's going to go fight for you. And I want to share a story of a patient of mine just a few weeks ago. He called me after he experienced a few new symptoms. It was like rash and a fever and chills. He had swollen lymph nodes in his neck, and he was just feeling really tired. And he went to an urgent care clinic and they checked him out. Hey, I think you have like a viral illness and it'll go away. Just give it some time, you need to rest. So he went home and he just kept feeling miserable. And he had this funny feeling that something wasn't right. So he called me, and immediately when he told me his symptoms, I sent him straight to the emergency room because I knew it was likely not something good. And he was eventually diagnosed with an acute leukemia, and so a type of cancer. And what I'm highlighting here is that my patient advocated for himself by calling for me. He knew that I knew his medical history, his medications, and all the things to put the puzzle piece together. And the lesson here is things happen, but always listen to your body. And if something doesn't feel right, it's not. Speak up. Okay. All right. So these are common questions that I think you should always ask your doctor during your visit. It can sometimes feel easier to just go along with things instead of asking questions, but don't. So you want to ask is, would you recommend this to your family member, your sister, your brother, your wife? That question is powerful. It actually can cause your doctor to maybe stop or change their recommendation for you, and they can tell you why. Sometimes I got to tell you, I'm guilty of this too, but we'll tell patients what the guidelines say. What is the standard of care, meaning what do most other doctors recommend? And, you know, for example, if you're complaining of abdominal pain, like that's likely irritable bowel syndrome, your doctor may recommend a pill because that's kind of the next standard of care, right? But when you ask, like, what would you recommend to your wife or your family member, they may say, I probably wouldn't prescribe that pill, but I would do other things first. And that's the kind of care that you want from your providers. You want to know that they're doing what they would do or telling you what they would do for their loved one. Okay. And the other thing is, if you don't understand something, ask to get clarification. Healthcare lingo is literally a different language. And I get it. Whenever I look at a legal document, I literally feel stupid and confused. And I'm just thinking, why can't lawyers just write contracts in plain English so people can just understand? Healthcare is no different. So just don't be afraid to ask questions. Or an even better way to do this is say, I don't understand. Can I just repeat what you just said and I will see if you understand me? And so, in your own words, you can repeat what the physician just told you, and then they'll correct you if you misunderstood or say something that's not correct. And then you always want to ask, what are the pros? What are the cons? What are the risks? What are the benefits? And you never want to leave a visit knowing what's next. Like, when do I need to schedule my follow up visit? Or am I done here? And you never want to see me again. So you got to ask these things. And then lastly, you want to ask what resources there are. There are a ton of online resources, organizations, nonprofits, or self help groups that your physician can point you in the right direction. You want to try to avoid blogs or Facebook groups or communities for medical information. They can be awesome in many ways, but also kind of overwhelming, I got to tell you, and riddled with false information, some gimmicks. So take it for what it's worth. I think it's a great sense of community and you don't feel you're alone in your journey for health. But there are some excellent Facebook groups. You just got to find them and kind of weed through the noise, so to speak. Okay. So here are just some basic labs that that I want you to know that they're not always necessary, but if you have symptoms like diarrhea, for example, you're going to get a lot more testing done, and especially stool testing. But these are basic lab testings that should be included if you're trying to evaluate gut health. And here's the thing: don't be freaked out if your doctor doesn't order all these tests, because it may have been that they thought you didn't need it. So just ask if you want to know. This list is just meant to be a guide to be on the lookout for what to expect or ask. And the thing is, I want you to realize is that if extra tests are ordered and it's just because you're curious, you just want to know, like I want to know what my zinc level is, right? Your insurance provider may say that that test that you just wanted to know isn't medically necessary, and then you may be paying for that out of pocket. There always has to be, in the way our healthcare system works, justification for medical necessity. So, so sometimes when you feel like your doctor's just not ordering tests that you feel may be necessary, it's because the doctor recognizes, or the physician you're seeing, that it may not be medically necessary for your condition. I'm sure you've experienced a surprise bill, and I've gotten it, and it's just no fun at all. But, your CBC is basically looking at your blood counts and making sure you're not anemic, and looking at your platelets. So, how do you clot? And your CMP, your complete metabolic profile or panel, includes looking at your kidneys, looking at some of your electrolytes, looking at your liver, and your CRP is a blood test that looks for inflammation kind of going on in your body. And not everyone makes CRP, so that's just something to kind of be aware of. Like, it could be normal in some people, but still have a lot of inflammation going on in their body. But that's something to definitely be note of. The TSH is a function of your thyroid hormone and thyroid function. And your fecal calprotectin is a way we can check for stool inflammation or inflammation in your digestive tract. It doesn't tell you where or how severe or what kind, or why is the inflammation happening, but it does tell us that some sort of inflammatory process is going on in the intestine, and now your doctor needs to figure out why. Celiac antibody is looking for celiac disease. So if that's positive, then that means you might most likely may have celiac disease, or a gluten sort of process where you eat gluten and then your immune system ramps up. So it's an autoimmune condition. Vitamin D levels, most people are recognizing that low vitamin D is almost bad for anything. So we're almost across the board just always getting a vitamin D level on most patients. Iron studies, so you're checking for iron, like how do you store iron, what's your normal iron levels, so that's really helpful. And then for gut health specifically too, this H pylori test, or Helicobacter pylori, there's various ways we can test for it. So it doesn't have to be a blood test or even a stool test, it could even be a breath test. But and then biopsies of the stomach. But they're just know, like, that's a very common test to get for gut health, especially if you're complaining of abdominal pain or symptoms of heartburn. Okay. So this is just meant to be a guide, just to know that if you went in and you were complaining of abdominal pain and you didn't get any labs, well, that's obviously a red flag. Because you want to make sure that you get something done to make sure that there's nothing that needs to be worked out further. Okay. And whenever there's a doubt with your experience, get a second opinion. It doesn't have to be a breakup with your doctor, but it can also be validation for you and your doctor that you're on the right track. If you broach the subject by just saying that you want to seek a second opinion up front, there shouldn't be hard feelings, and you can decide who you want to continue seeing. But a second opinion is always on the table, and don't feel uncomfortable about it. And your doctor shouldn't feel uncomfortable about it. And honestly, we love it if someone says that they want to get a second opinion and we know up front. But then the patient maybe comes back to me and says, "Hey, I got my second opinion and now I feel good with our plan. Let's move forward." The other doctor said the same thing. Or maybe, it can be a collaborative thing. So it's honestly, it's all about communication. And if you don't feel comfortable with your doctor to even communicate that you want a second opinion, then that person may not be the right person for you. So, all right. So that was it. I hope that you have got a lot of value from today's presentation. I really want you all to be advocates for your own health and navigating this crazy healthcare system. And I hope you found a lot of value. Please send me an email with any questions at hello@labelisemd.com, or you can message me on Instagram, labelisemd. And I look forward to my next workshop. Just stay tuned for that. It's going to be what's the deal with gluten. All right. See ya.